Hi, this is Dr.Shuba Reddy, taking care of NICUs, complicated pregnancies, perinatal medicine. We'll continue in this session. We discussed about the blood flow, mean arterial blood pressure, and then we are discussing about the oxygen. How is the oxygen being circulated in the fetus? This is very important slide that we will be discussing now. You should understand this slide very carefully. If you see these things in this slide, this is number 16 slide. Okay, this shows the fetal circulation. This shows about the fetal circulation and the fetal hemoglobin. If you go through this fetal circulation, in the fetal circulation, the max saturation is happening at the ductus. You can see there is a ductus arteriosus. You can see 52%, whereas in the saturation is predominantly in the ascending aorta 65%. In the ductus venosus, you can see somewhere around these things. Umbilical vein saturation is 80%. Inferior vena cava 20%. Somehow when they are getting mixed, somewhere around 62 to 65%. When the blood that is reaching to the heart and just in the ascending aorta, this is very important. When the blood reaching to the heart and the blood that is being in ascending aorta, you can see there is 65% of the oxygen saturation. Followed by that in the descending aorta, if you see there is only 55% of the saturation. So this is fixed. Even if you increase the amount of the oxygen in the mother by keeping oxygen or anything, or the hyperbaric oxygen also, this is fixed. Remember, the descending aorta is carrying 55% of the saturation, whereas the ascending aorta is somewhere around 60 to 65%. Why we will be discussing this? Because the middle cerebral artery flows will be discussed further, and then you need to know what is the logic that is happening there. This is slide number 17. Slide number 17, different forms of the waveforms or the pleths will be noticing. Similarly, the different forms of the pleth waveforms will be there even in the fetus. Okay, this is normal waveforms, small weak pulse, large bounding pulses, and the pulses difference. These are things that we see in the monitors in the ICU. Similarly, we will be seeing the same things in the fetus also, where there will be different changes in the Doppler waveforms. Due to different changes in the Doppler waveforms, okay, how we to identify where there is a decreased blood flow to the end organs will be identifying through this thing. Now we will be discussing again with the slide number 18. This is the slide number 18 shows the same thing like previously what we discussed, the importance of the diastolic blood flow. The mean arterial blood pressure is 1/3 of the systolic and 2/3 of the diastolic blood pressure. Oxygen we noticed how the oxygen is circulating. Now we know the circulation of the fetus of the baby, what is the mean arterial blood pressure, what is the oxygen content in the blood. Now we will be discussing about the Doppler changes that is happening and how to assess that the baby is in the acidosis or not. This is what that is being seen. This is what we will be seeing in the slide number 17 shows what are the waveforms that we will be seeing in the monitor of the ICU. In the monitor, we will be seeing the weak pulse, large bounding pulse, pulses difference. These things will be seen. Similarly, the obstetrician or radiologist or fetal people will be seeing some other waveforms. Comparatively, waveforms are same thing. If you can see the same waveforms, how the pulses are there, how the waveform is changing, systolic, diastolic, how these things are being changed, and what is the end organ perfusions being identified with this. This is an important slide that is there. Now we will be discussing this thing. The first one is normal blood flow, normal, higher one. In other comparison, I am showing what is the thing in the next slide is adjacent one is the mean arterial blood pressure. When the mean arterial blood pressure is so good, means there is a complete systolic and there is a good diastolic. Systolic pressure plus 2/3 of the diastolic pressure maintains the mean arterial blood pressure. When there is a mean arterial blood pressure is good, you can see the normal waveform where there is a good amount of the diastolic, and coming to lower one. Okay, now see, you can see the arrow mark is showing there is an absent end diastolic blood flow. When we say that there is an absent end diastolic blood flow, When we say that there is an absent end diastolic blood flow, once again, if you compare with the mean arterial, what is the mean arterial blood pressure? Mean arterial blood pressure says that there is a 1/3 of the systolic plus 2/3 of the diastolic. Now there is an absent diastolic blood flow or decreased diastolic blood flow. Prior to absence, there will be decreased diastolic blood flow. When there is a decreased diastolic blood flow, obviously the mean arterial blood pressure is coming down. When the mean arterial blood pressure is coming down, there is a decreased perfusion to the end organs. The end organs are of the fetus is nothing but the kidneys, adrenals, brain, everything. These are the end organs. So when there is a decreased diastolic blood flow, obviously there is a decreased mean arterial blood pressure, decreased perfusion to the end organs, and obviously decreased urine output. This is a chronic hypoxia status. Decreased blood flow is followed by absent diastolic blood flow. When there is an absent diastolic blood flow, defines that the end organs are being perfused in the systole only. So mean arterial blood pressure, only systole is contributing to the mean arterial blood pressure. Followed by that, there is a absent is followed by reversal. When there is a reversal, suppose absent diastolic blood flow means there is a when we discussed about these things, end organ for the baby, for the fetus, the placenta is an end organ. So what we define, when in the good mean arterial blood pressure, there is a good flow from the fetus to the placenta. Obviously, when there is a absent diastolic blood flow, because of the decreased mean arterial blood pressure, there is obviously the end organ is one end organ is the placenta for the baby. So obviously there is a decreased blood flow to the placenta. When we say that there is a reversal of the end diastolic blood flow, with the reversal of the end diastolic blood flow, the whatever that is coming to the placenta is a deoxygenated blood. Reversal of the end diastolic flow defines that there is a re-entry of the deoxygenated blood into the fetus. Remember, the deoxygenated blood has to go into the placenta. When there is an absent diastolic blood flow, there is a decreased mean arterial blood pressure. The baby to the end organ perfusion is coming down. When the end organ perfusion is coming down, renals, adrenals, brains, everything is coming down. Obviously, the baby growth will be in a restriction. Followed by that, there is a decreased supply of the deoxygenated blood from the fetus to the placenta. Whereas, when there is a reversal of the end diastolic blood flow, there is a reversal of the deoxygenated blood into the fetus. When there is a pooling of the deoxygenated blood, continuously, the baby is building up the acidosis. This is what we need to understand the logic. When there is an absent, obviously there is a hypoxia is happening. When there is a reversal is happening, the baby is landing in asphyxia state. Reversal defines whenever there is a completely the blood flow, deoxygenated blood flow is being pushed into the reversal link. So there is accumulation of the deoxygenated. Continuous pooling of the deoxygenated blood leads to building up of acids. And the baby expiry happens. So we understood now what is the perfusion that is happening with the normal, absent end diastolic blood flow and reversal of the end diastolic blood flow. This will be monitoring. This will be monitoring in the Dopplers. This is slide number 20, which is showing how this will be, what we'll be seeing in the Dopplers. In the chronic hypoxia. So there is a mild difference between the adult hemoglobin and the fetal hemoglobin. Okay, this will be seen here. If you can see, go through this slide number 16. The fetal hemoglobin is different. Fetal hemoglobin is completely different. It can bind, which can suck from the placenta and then can deliver. Okay, we are going. If you can see these things, there is a different fetal hemoglobin is there. so that even with the saturation of 65, 55, the delivery of oxygen is very good here. Coming to slide number 22. Now we will be discussing, suppose there is any of the things, we will be having some reserves. What this is going to show is, when there is a decreased blood flow, first rule of the life what we explained is the adaptability, how the baby is getting adapted. In the adaptation process, what is the changes that is happening with the decreased blood flow to the baby? When there is a decreased blood flow to the baby starts reorganization of the blood, redistribution of the blood to the organ, that is most important. So, how this redistribution is happening, how to identify this redistribution in the Doppler changes. This is how it is shown. In the slide number 22, we are seeing these things. When there is a uterine blood flow, percentage of the blood flow that is being circulated to various organs is being shown in these things. This is the thing. This is a mammalian diving reflex. As a rule, this is the slide number 23. This is okay. As a rule, mammalian diving reflex, we are all the human beings that the life has started in the ocean. We know almost all the life has started in the ocean. And slowly, few of the organisms or animals started creeping out. We are all swimmers initially. And then we slowly came out to the land in search of the life. Okay, slowly the limbs has been developed. Terrestrial behavior had been started. But per se, since that we are all came from the mammalian, we are all mammals, even though we are originated from the oceans, we have certain reflexes in our body. Those are the mammalian diving reflexes. This is how it is. Even the mammals in the ocean, we can see how the mammals in the ocean. When a mammal or animal is, suppose we entered into the land. When during the hunting process, for the searching of the food, obviously this mammal re-enters into the ocean. In search of the food, it will be searching for the prey. In search of the prey, to some extent, whatever the oxygen that is being utilized, it is being used in the ocean now, in the swimming process. If that mammal which is hunting the prey lacks the oxygen now, it starts redistribution, yet the hunting process is ongoing. It starts redistribution of the blood predominantly to the brain and heart and adrenals. This redistribution is called as a diving reflex. Since these are all that we gained through our origin of the life, this is called as a mammalian diving reflex, and the fetus inside the uterus is also having the same mammalian diving reflex. The diving reflex says, whenever there is a decreased blood flow or decreased oxygen to the fetus starts redistribution. This, as per se, we got it from our origin of the life. When there is a decreased oxygen, the oxygen will be redistributed to the organs which is needed at that point of the time, like brain, heart, adrenals. So, how this redistribution? When this redistribution is happening, itself defines that there is a hypoxic situation happening. This can be we can easily find out in the Doppler forms, in the fetus. This is the seal, all these are the mammalians. When the mammalians go inside during the hunting, we can see that their blood supply to the brain, heart and adrenals is increasing. There is a decreased blood flow to the skin, intestines, everything. This diving reflex, when the diving reflex is on, this is like a master switch of the life. Master switch of the life has on. Like suppose in the house, if there is a absence of the electricity, then the generator is on. The generator has certain lifespan. It may give electricity for another 10 hours or 8 hours. It depends upon the electricity power, the backup. Okay. Similarly, this is like a backup. The mammalian diving reflex is a backup for the baby. This mammalian diving reflex is happening when there is a diving reflex happen, brain sparing effect happen. When the brain sparing, we call it as a brain sparing effect. Brain sparing effect is happening. This is a master switch of the life is activated. How to identify that? And other waveforms that we'll be seeing here is ductus venosus Doppler. See, this is ductus venosus Doppler. In the ductus venosus Doppler, one minute, I'll be discussing this one with the like a diving reflex that is there. This will be discussing now. Okay, when the obviously when there is in the chronic hypoxia, this is slide number 23. Same brain sparing effect. What is called as a brain sparing effect? Sometimes when they are writing in the as this is a brain sparing effect has happening in the fetus, what you need to understand is that there is a master switch of the life has been activated. Master switch of the life activated defines see how to correlate. The mean arterial blood pressure of a person is 1/3 of the systole and 2/3 of the diastole. Obviously, all the organs in the body, all the end organs or organs of the body are being supplied with this mean arterial blood pressure. When there is something like a chronic hypoxia, the mammalians have the mammalian diving reflex. We are all having the diving reflex. That diving reflex will change that will redistribute the oxygen that is being circulated to the predominantly brain, adrenals and heart. That is called as a brain sparing effect. How to identify this brain sparing effect? What is that the brain sparing effect in a fetus means? When there is a decreased blood flow, there is a decreased diastolic blood pressure, decreased mean arterial blood pressure. So obviously during the chronic hypoxia status, there is a decreased mean arterial blood pressure. So all the organs are being having decreased diastolic blood pressure. Decreased diastole means when all other organs are having the decreased diastole blood flow, and when the diastolic blood flow of the brain is increasing. Listen one second. When all other organs diastolic blood flow is decreasing and the brain diastolic blood flow is increasing, defines there is a brain sparing effect happening. Okay, because the body is being adjusting and redistribution, brain is the most important organ for the development, so it is utilizing the diastolic blood flow also to maintain the brain circulation. All other organs diastolic blood flow decreasing, whereas the diastolic blood flow of the brain is increasing, defines that there is a brain sparing effect happening, and that is the master switch of life is activated. We'll continue in the next session.